Stroke is the third leading cause of death in Ireland, following heart attacks and cancer. Every year in Ireland, over 8,000 people have acute strokes. Most of us know little about the causes of stroke and even less about what can be done to prevent it. The aim of this video is to explain the causes and risk factors associated with stroke and the steps you can take to help prevent you or your loved ones having a stroke.
Parked my car, and when I got out, the world started to spin, and I thought of my stomach. I went around the back of the car to open the boot and keeled over as a stroke.
I sat up in bed to try and eat some food, and when I sat up, I suddenly fell back and lost all power of my left-hand side, and I lost my speech.
Technically, a stroke is an interruption to the flow of blood to the brain.
There are two medical terms for the two major types of stroke. One is called an ischemic stroke, and the other is called a hemorrhagic stroke or bleeding stroke. An ischemic stroke happens when there is blockage to a blood vessel supplying the brain. When this happens, the oxygen and nutrients that the brain requires to survive are not delivered to the brain, and the brain can die in that area. In a hemorrhagic or bleeding stroke, one of two things may happen. Either a blood vessel inside the brain ruptures, which causes a blood clot to develop inside the brain, and this is called an intracerebral hemorrhage, or a blood vessel outside the brain's surface may rupture, and that causes blood to spill around the surface of the brain, and that causes a stroke called a subarachnoid hemorrhage.
There are a number of things that can increase your chance of having a stroke, and we call these risk factors.
The most important one is really smoking, and smoking cessation at any stage. So if you're had a stroke or if you haven't had a stroke, it's something that you should aim to stop. Hypertension or high blood pressure, even in individuals who have no history of hypertension, if you have had a stroke, it is useful to try and reduce the blood pressure still further. Diabetes, it's important to try and maintain your blood sugar as closely as possible within normal limits. High cholesterol or LDL, the bad cholesterol, is also a risk factor for developing a stroke. Also, excessive alcohol ingestion. If somebody leads a particularly sedentary lifestyle, it's important that they should engage in some form of regular activity.
There are a number of steps we can take to reduce our risk of stroke. People with high blood pressure are 4 times more likely to have a stroke.
Well, I had high blood pressure, and I was being treated for high blood pressure for 12 years before, and my blood pressure was still inclined to go up at times, and my GP would say, you know, when it goes up like this, you're at risk of a stroke.
I didn't know I had blood pressure until I had the stroke, and then they told me in the hospital that it had gone through the roof, it was so high.
High blood pressure is a common but very treatable risk factor for stroke and for heart disease. Your blood pressure varies naturally as you go through a normal day. It goes up when you are physically active or stressed. It also tends to rise with age.
In general, people who have not had a stroke should have their blood pressure checked at least once or twice per year with their general practitioner. People who have had a stroke should have their blood pressure checked at least this frequently, if not more frequently, particularly if the blood pressure is reading high. There are several avenues that are generally taken in routine practice to lower blood pressure. One of the most important is to avoid excess intake of salt in the diet, and we generally advise people with high blood pressure not to add salt to their food. Another important strategy is to get regular physical exercise, at least 3 times per week for 30 minutes per session, according to current guidelines. And this has documented benefits for reducing blood pressure.
Diet, weight, smoking and exercise all contribute to the level of our blood pressure. A person's diet is extremely important in helping prevent stroke. Go easy on high-fat foods such as fats, oils, fast foods, sweets, biscuits and cakes. It is best to have 2 portions a day of protein foods such as meat, poultry, fish, eggs, or peas and beans. Try for 3 portions of milk, cheese or yogurt a day. If you are overweight or have high cholesterol, choose a low-fat version. Fruit and vegetables are very important for a healthy diet.
Diet is extremely important. It's a risk factor that we can all do something about to try and avoid any cardiovascular complications, so not just stroke but also in terms of heart attacks and peripheral vascular disease. Nowadays, because of our sedentary lifestyle, there is an epidemic, if you like, of obesity. And obesity is an independent risk factor for all vascular diseases, including stroke.
Reducing your weight and exercising regularly may also reduce blood pressure.
Sometimes, unfortunately, it's not enough to avoid salt intake, take regular exercise and control weight. And a medication, or sometimes more than one medication, is required to get the blood pressure to an appropriate level.
Giving up smoking greatly reduces the risk of stroke and heart disease in younger adults. Smokers who quit begin to reduce this risk almost immediately.
For current smokers, observational studies in communities have shown that the risk of stroke associated with smoking reduces to that of non-smokers after about 3 years of smoking cessation. So there are real advantages to be gained in terms of preventing future stroke by quitting smoking.
Don't forget to exercise. Exercising for half an hour most days of the week will help you to maintain a healthy weight, help you sleep better, strengthen muscles and bones, lower blood pressure, reducing your risk of stroke and heart disease. If you already have high blood pressure and positive lifestyle changes have not reduced it to normal levels, your doctor may prescribe medication to reduce your blood pressure. High blood cholesterol also raises the risk of heart disease and stroke. This is mainly due to the effects of LDL, or bad cholesterol. Reducing LDL cholesterol lowers the risk of stroke and heart disease to about 1/3 in stroke survivors and people who have never had a stroke. To lower LDL cholesterol, the first step is a healthy lifestyle with a good diet and regular exercise. If you suffer from diabetes or atrial fibrillation, also called irregular heartbeat, or have suffered from a previous stroke or mini-stroke, it is important to discuss these with your doctor and identify what measures you need to take to reduce your risk of stroke. Having already had a stroke or mini-stroke is the most important risk factor associated with a higher risk of future stroke. The good news is that this risk can be lowered by appropriate treatment and attention to blood pressure, quitting smoking, looking after cholesterol, and the other factors previously mentioned.
4/5 of stroke are due to blockage of a blood vessel, in other words, an ischemic stroke. In that situation, blood thinners have been shown to prevent the risk of a second stroke happening by somewhere between 20 and 30%.
Stroke seems to strike out of the blue, but often our bodies send us signals, which, if recognised, can act as a warning, telling us that there's something wrong.
When I woke back up, the vision in my left eye, part of the vision was gone. So if I was looking at you, I would only see basically half of your face. And that was the first indication that something was wrong.
Couldn't lift my arm or leg, and then gradually I just tried to lift my arm. I couldn't, and for a few moments, then gradually the sensation came back into it.
Although many strokes occur without warning, in some cases a full-blown stroke may be heralded by a mini-stroke or warning stroke. So it can be important to know about the signs of these early or mini-strokes in order to seek medical attention early and perhaps prevent a full-blown stroke. So there are several warning signs of mini-stroke or warning stroke. One of these warning signs is sudden loss of power in one arm or one leg or one side of the face. Another warning sign is sudden loss of feeling or tingling down one side of the face, arm or leg. Loss of speech or slurring of speech is also an early warning sign of stroke, or sudden abrupt onset of difficulty with balance. Sudden loss of vision in one eye, and finally severe sudden headache, unlike any headache that a person may have ever had before, may sometimes herald a bleeding type stroke.
The problems we have outlined are physical, but what about the stress which the patient and their families experience in the aftermath of a stroke? Things once taken for granted are so much more difficult, if not impossible to do, such as being able to move about freely and the inability to indulge in various activities. This goes as much for the carer as for the patient.
Rehabilitation is an ongoing process. It's a process that starts in the acute hospital, continues if the patient has access to a rehabilitation facility, and should continue on after the patient has been discharged.
Today I was at the stroke club this morning, for example, and we had great fun. And we have one wonderful lady, Tess, who does drama with us. And there's a great camaraderie. We all have great crack, and we played skittles this morning, the women against the men. The women won. I'm just glad to be able to do what I can do, and I don't think about the things I can't do it really anymore.
In 1985, the Volunteer Stroke Scheme was founded to provide support for people who find their lives changed by stroke. They offer both information and knowledge about stroke. They also offer emotional support and a social outlet in their stroke clubs.